people come in with severe autoimmune conditions or like very chronic low back pain. That's usually what you see, sciatic pain. So I tell them, I'm like, hey, I can adjust you and I'm going to give you some relief. Sometimes we can get it to where, they don't have any problems with that at all anymore. So very successful with that, or they have a radiculopathy in the arm, anything like that. A lot of times we can fix that. But if I can't get that to go away just within a couple visits, I'll tell them like, hey, we need to look a little bit deeper because this might be more than just, you have an injury to that area and we can adjust it back to health. Sometimes it's inflammatory. So I see a lot of polyarthritis that's undiagnosed. And then a lot of, like I said, chronic low back pain. I think a lot of that can be taken care of with a proper nutritional diet. So I made my own protocol, just kind of detailing what the carnivore diet is. So I give that to almost every patient that comes through the door. And I tell them like, hey, if you don't want to be in here with these same problems, and you actually want to fix yourself, you should probably consider doing something with your diet. Not a lot of people want to do that. They just want the quick and easy fix, and that's unfortunate. But as long as you plant that seed, that's kind of that's my mentality with it.
Yeah, there's obviously there's clearly some people want to do it because we have this community of thousands and thousands of people that are doing it, and clearly they're seeing a difference. And so, within and I assume it varies by state to state, as to how much purview chiropractic is granted, whether you can treat certain conditions or not. How is Ohio? Can you can you have a diabetic come to you in Ohio and say, hey, I want chiropractic care for my diabetes, and you could conceivably say, hey, here's a nutritional solution. What kind of?
Actually, I do have a patient right now. He's completely reversed his diabetes. You can order blood work as a chiropractor. You cannot, obviously you can't get into the medication side of things. You can basically ask their primary care, like, hey, can you get him off of this? Or, so my one patient, he had an A1C of like 7, something like that. But he'd been carnivore for about 3 months, took it down to, I was around 5, I want to say, maybe a 5.3. But I'd imagine, and his primary was amazed by that. So he just said, keep doing what you're doing. But yeah, I had actually showed him kind of that side of things, like how to eat, and just go on the carnivore diet. But as far as managing someone's case, as long as they're willing to talk to their primary, if they want to get off of a medication or something like that, like a blood pressure med or a statin or something like that, those are the most common ones that I run into. I'll tell them like, hey, you don't have to be on that. I can't say like you should get off of that, and that's what I say. But I make recommendations more than anything.
Yeah, you can't technically deprescribe or prescribe, I assume. Is that true?
Correct.
Yeah.
Okay. Correct.
Yeah, that's one of the limited. That's one of the powers that doctors have, the power to prescribe prescriptions. And
right.
It's kind of maybe a double-edged sword, and maybe it's
right. And I had a buddy that I was in school with, and he ended up leaving halfway through chiropractic school because he wanted that. He wanted to be able to prescribe medications or take people off their medications without consulting anybody else.
Yeah.
Which, that'd be very nice, but
yeah. Well, and as I see literally people coming off medicines every single day, and I'm just out here on social media talking about this stuff and getting people to tell you I got off my meds. We are fortunately, in the middle of building our company out where we're going to be able to do that on a regular basis, which I'm pretty excited about. Let me ask you a little bit about more your own personal sort of thing. So you said you tried the fruit thing, it didn't work. You went to more restrictive. You tried to put some stuff back in. So what does a diet look like for you currently? And how long you've been doing this now for 6 months or something, or how long you been doing it?
Since March. So what's that? Not 10.
It's December. So 12 months, 9 months.
11.
Yeah. 9 months.
Yeah. So around that amount of time. So on the daily, what usually happens, I'll wake up. I still do coffee, so I do cheat in that sense, I guess. But it never gives me any problems usually that I've noticed. I was still able to kind of achieve my goals without cutting that out. I do that in the morning. I don't eat until about lunch. So I come home on my lunch break, and then I'll eat probably maybe a little over a pound of meat. I'll do ground beef. I'm trying to plug through my ground beef right now because I got a ton of it.
Mm-hmm.
So I've been doing that as of late, and then at night I'll either do like a steak or my wife will make a roast for us, something like that. So usually, like I said before, about 2 to 3 pounds of meat a day. But again, it's pretty strictly red meat. I'll do eggs on the occasion. I don't usually have any problems with that.
Yeah, and then as far as I mean, are you focusing on protein, fat percentages, or how do you sort of
So
navigate
I
that?
noticed when I did when I had very fatty meals, like I'll eat like a brisket or something like that, or ribs. I like digestive. I can't digest that high fat content yet. Like I guess I eat probably 80-20, maybe 75-35 burgers, or 75-25 burgers, excuse me. And those, that usually sits pretty well, and I feel satiated throughout the day. I don't really have a desire to eat. I don't really measure like fat or protein content or anything like that. I kind of just eat till I'm full. And I've been trying to eat more lately because I'm trying to put on a little more weight.
Yeah, I mean, you said you'd fasted till you got like super skinny. I mean, how light did you get, and where are you at now? And where are you at with your body composition? Are you staying fairly lean, or what do you got? What's going on?
Yeah, I was naturally born with a very, very fast metabolism, so that's my genetics they predispose me to being skinny. But after I got married, I put on probably 40 pounds, and that's when I started to do a little bit of intermittent fasting and extended fast, and I got my weight down to like what it was when I was in high school, which was like 170. I'm about 183, 185 now since I've been doing carnivore. So I was about 170 from the time I had done my fasting and all that until I started carnivore. So I put on about probably 13 pounds, and I've stayed pretty steady at that.
Yeah. How tall are you? Just
6'3".
6'3". Okay. So you're definitely not overweight. No, you definitely not be accused of that. So very good.
Yeah. I'm pretty skinny, but I've been trying to put on a little more weight, but yeah, it's just like, you just feel a lot stronger too when you're eating this way. So I don't know if it's all mental or like why the heck that is, but I just feel like I don't get worn out. So like I used to be, pretty tired by the end of my Thursdays are my biggest day. I usually see anywhere from 30 to 40 sometimes. 40 is a really busy day for me. But at that point, like at the end of the day, I used to just be absolutely beat. But now, like, I could go out and do it for another couple hours, no problems.